Hello. Today on World Thalassemia Day, I want to share an important message about thalassemia major, a disease that affects thousands of children and families around the world. This is not only a medical issue, it is also a social, emotional, and economic challenge. But the good news is many cases of thalassemia major can actually be prevented. Let's talk about thalassemia. What is thalassemia? Thalassemia major is a serious inherited blood disorder. Children born with this condition cannot produce normal hemoglobin properly and they cannot produce normal blood properly, so they develop severe anemia. These children often require lifelong blood transfusions, regular hospital visit, iron chelation medicine, continuous monitoring, and sometimes bone marrow transplantation or gene therapy. Thalassemia is inherited in an autosomal recessive pattern. This means if both mother and father are carriers of thalassemia trait, then in every pregnancy there is a 25% chance the baby will have thalassemia major. A 50% chance child will become a carrier, and a 25% chance child will be completely normal. Many parents discover they are carrier only after their child is diagnosed with thalassemia major. For many families, this information comes as a major shock. Parents often regret that they were never tested earlier, because this condition could potentially have been prevented if they had known their carrier status before the marriage or pregnancy. That is why it is extremely important for all young adults planning marriage or pregnancy to know whether they are carrier of thalassemia through a simple blood test, hemoglobin electrophoresis. Now, let us talk about the cost of treatment. Treating thalassemia major is extremely expensive. A child requires blood transfusion every few weeks throughout life. In addition to this, repeated blood transfusion, it can cause iron overload in the body, require lifelong iron chelation treatment. Excess iron can damage major organs and may lead to serious complications such as heart failure, liver failure, hormonal problems, growth failure, and many other long-term health complications. Total lifetime treatment cost can exceed more than $500,000. This is also depends on which country they live and which healthcare system they follow. Now, we also have newer treatments such as bone marrow transplantation, gene therapy, and advanced targeted medicines. These treatments offer hope, but they are extremely expensive. Some currently available gene therapies cost more than $2 million per patient, and developing a single gene therapy may cost billions of dollars and take more than 10 years of research and development. This creates a major challenge for healthcare system worldwide, especially in low and middle income countries. Let's talk about power of prevention. Now let us compare this with prevention. Carrier screening is actually very simple and affordable even in low resource countries. It is a simple test by doing hemoglobin electrophoresis. Prenatal screening programs are also highly effective and already well established in several countries. Studies show that this program can significantly reduce healthcare costs and prevent many high-risk marriages. And even when two carriers decided to get married, there are still options with modern IVF technique and pre-implantation genetic diagnosis. Doctors can identify embryos without thalassemia major before pregnancy. Although PGD may cost $10,000 to $20,000, this is still far less expensive than lifelong treatment or gene therapy for thalassemia major. More importantly, it can prevent enormous emotional, financial, and physical suffering for both child and the family. My message is very simple and clear. We should not focus only on expensive treatment method. We must focus on awareness, early detection, career screening, genetic counseling, and prevention. Every young adult should know their thalassemia carrier status before marriage. Every family with a history of thalassemia should receive proper counseling, and healthcare system should invest more in prevention program. Because prevention is not only medically effective, it is also socially responsible and economically sensible. So, in conclusion, my message today is let us work together to create a future where no child suffers from preventable genetic disease like thalassemia major. Awareness can save lives, screening can prevent disease, and education can protect future generation. Thank you very much.